Hi, everyone, and welcome to Making on Monday. I'm really glad to be here. I haven't been here for a little while, so I'm super excited to be here live with you. And today it's a Q&A. So I've got some questions I'm going to answer. And if you have any questions, pop them in the group, in the IVF Acupuncture Support Facebook group, and I would love to answer them. So just a little recap, Making on Monday, it's all about mums and dads in the making. So we're here to kind of support and educate you, giving you some research-based resources to help you conceive and have a beautiful baby. So it's all things IVF and fertility tonight. And the first question I got was from someone, and this happens all the time. We have patients who come in and they've actually already done their IVF cycle in terms of had an egg pick up and they have some embryos, but they're wondering what they can do in terms of a frozen embryo transfer and what they can do in terms of, getting the best chances they can out of that little embryo. So today I am going to run through some of like kind of our top tips in terms of the things that you can do in the lead up to a frozen embryo transfer. And I'm also going to talk a little bit about some of the common things we're asked about, like what we can do more, and also about sort of sperm health, like what can my partner do? Often we're seeing the female, often the male doesn't get much of a look in. Even specialists will often just look at the results, and if they're in the parameters vaguely, they won't sort of suggest anything. So really key. I might just talk a little bit about the 101 on egg and sperm health. I think that's going to be really useful for everyone. But to start off with, let's start off with the first question, which is all about frozen embryo transfer. So when you're about to do a frozen embryo transfer, you obviously already have the egg and the sperm and it's made an embryo. So we're not working on egg quality, not working on sperm quality. But what we want to do is really make a great environment for implantation. So implantation is when the embryo starts to attach. Eventually, it creates a pregnancy and it creates placenta. It's a really important part of being pregnant. And often, we are just waiting in that 2 weeks between ovulation or embryo transfer. And when we get our period with our fingers crossed, hoping that, this time it's worked, but not really understanding maybe too much about the mechanisms or things you can do in the lead up. And really, I kind of need to stress that everything in terms of what you're going to help with in terms of an embryo transfer, most of it comes before the embryo transfer. So after, there's not a lot that's really going to do much in terms of helping its success or hindering its success, which in a way is good. If you've had an embryo transfer, you can actually just be like, I've done my job, outside of, drinking, smoking, other kind of like really harmful substances. There's not too much that you can do too wrong. High impact exercise. Okay, so there's a couple of things. All right, so let me get back to the point. We're talking about frozen embryo transfers and the things that you can do before a frozen embryo transfer. So we really want to work on our endometrial lining. So that's the lining of the uterus where that little embryo is going to want to kind of like nuzzle into and really like snuggle down. And this lining looks like it's like trilaminar in appearance, which means it's got 3 layers, and it's the sub layers that are really important in really important because they help bring the blood supply and the nourishment to that endometrial tissue, which looks a little bit like a sponge. If you have clotty periods or if you experience period pain, it's likely that that endometrial lining is a little bit uneven. And that's something, if you see an acupuncturist, they're often going to work on in terms of trying to get your period nice and smooth. And also what we're working on is that endometrial lining being really nice and fluffy and being kind of a really good quality so the embryo can implant. So I've mentioned acupuncture. I'm going to talk a bit more about the research in a minute, but I also want to talk about your diet because this can make it's a big game changer. So most importantly, amino acids are really important. And so amino acids you'll find in things like nuts and seeds, but you also find them in fish. And taking fish oil is a really nice shortcut to really increasing your amino acids. So that's one suggestion I'd make is making sure that your diet is like a Mediterranean diet. It's got lots of like nice fatty acids and amino acids because these are like the building blocks of cells. And they're really helpful in terms of building that nice endometrial lining. And so studies have shown that women who have diets primarily based in fresh vegetables with some fish, and have less meat and dairy, like red meat and dairy, have more favorable amino acid profile in their uteruses. And this is really important for implantation. So that would be kind of my tip number one. There's a whole lot of things why amino acids are so important in your uterus, but I think we'll leave it there for that tip. So, including things like eggs, fish, nuts, seeds, quinoa, these are all great things in terms of boosting your amino acid profile. The other thing I'd just probably mention while we're talking about the uterus, amino acids are really important, as are, making sure you're not having anything which is going to make a more oxidative stress. So things like, smoking, drinking, we know that all of these things, as you get closer to conceiving, either naturally or through IVF, like the closer you get to ovulation or your embryo transfer, every day you get closer, that drink impacts, or that cigarette impacts a lot more. So it, in terms of reducing your fertility and reducing your likelihood of conceiving and carrying a healthy pregnancy. So just in that lead up, really important as you're kind of coming up to really kind of lay off drinking. And if you're going to have a drink, make sure it's really moderate. Definitely no more than one drink, but I'd probably avoid it, particularly if you're doing IVF and you put a lot of money and time into this process. So that would be another really big tip. And while we're at it, I'm talking about the uterus, I want to mention the microbiome. And if you haven't heard of the microbiome, well, I'm going to tell you a little bit about it. So as we have in our gut, we've got all the good bacteria and we've got all the bad bacteria. And what can happen in our vagina, and which then kind of also goes up into our uterus, is that we can have sometimes some dysbiosis, which means we've got more of sort of the bad bacteria and not that many of the good. And this can happen through using antibiotics. It can happen through even lubricants. It can happen through different personal hygiene products that we use, or soaps. And I guess, it can also just happen from the food and drinks and things that we have. So if you're someone who has had, I guess, lots of things like thrush, or you've had any STIs, or you've had any signs and symptoms that things are just not as happy as they could be down there, then it's probably a really good thing to address it before you get up to embryo transfer. And so one thing I'd consider is talking to a naturopath or acupuncturist, which specializes in fertility like we do. And they'll be able to help you in terms of prescribing you a probiotic, which is especially for the microbiome in the uterus. And why is that important? So there's been a lot of research done over the last few years about the uterine microbiome, and they've found when you have more of those bad bacteria and not enough of the lactobacillus, that it really heavily impacts implantation. Hugely. So we want to make sure that that's a really healthy environment. So one thing you can do in the lead up is to really sort of check that out and make sure that everything's kind of going really well in terms of your uterine microbiome. There's some sort of tests that you can do, but also just talk to a qualified practitioner, because they're going to send you in the right direction in terms of testing, and also so the type of probiotics you should be taking, because there's specific strains. So that'd be my next tip. The other thing I'd consider if you're about to have an embryo transfer or you're trying to conceive is during your period time to be really careful. So from a Chinese medicine point of view, when you are having a period, it is a time when you really need to rest, and it's a time when your hormones are resetting. And if you don't have that rest, it's really hard for them to replenish and then to go on for the next cycle and really kind of fuel up that next cycle. So we would highly recommend resting, heat, no cold swimming. You probably know how Chinese medicine practitioners hate that. And so making sure that, over that period of time, you're keeping really warm. The other thing I'd say, and I've presented on this quite recently last year at a fertility symposium, would be to consider taking some Chinese herbal medicine. There's been some great research done in terms of meta-analysis and also single herbal formula studies, and that's shown or suggested that it can really improve overall pregnancy rates. And one of the studies I often will talk about is a Hollander study, and she looks at not only using herbal medicine but also using acupuncture. And she calls this like a whole systems approach. And with this study, patients would have acupuncture the month prior and then the 2 weeks before their embryo transfer, or that they'd have about 12 sessions of acupuncture, so high dose acupuncture, before they get to embryo transfer, and also take herbs and supplements. And they found that the live birth, so not just the clinical pregnancy rate, but the live birth rate increased about 63% in this group. So that was a post-retrospective cohort study that took place in 2016, if you want to look it up. It's called by Hollander. So, of course, we suggest acupuncture and herbs. There's some great research around it. If you want to find out more about it, I've actually done a whole Making It on Monday about acupuncture and the research around acupuncture and IVF. And I've done a whole another one about herbal medicine. So you're welcome to look at those. But if you're just about to have embryo transfer, you've already got your embryo in the freezer, it's ready to go, I'd probably be suggesting catching up with your Chinese medicine practitioner as soon as you can, discussing maybe the possibility of herbs, and coming in probably about twice a week in the lead up. And that's going to really help with getting the best endometrial lining that we can. So there's been some research done around doing electroacupuncture, and you might have noticed if you come to one of the acupuncture pregnancy clinics, we often do electroacupuncture in the lead up to an embryo transfer. And the reason why we do this is because there's been research to suggest that it can really improve the quality of that endometrial tissue in the uterus, and really help in terms of endometrial receptivity. So I'd suggest coming in a couple of times a week for acupuncture, as well as like talking about herbal medicine. So they're probably some of the key things I'd think about if I was about to do an embryo transfer. So we've talked about amino acids, Mediterranean diet, healthy, making sure we're avoiding, smoking and drinking, anything that's going to add in any sort of oxidative stress into our body. We've also talked about reducing kind of red meat and dairy, resting when we have our periods, and also some acupuncture and herbs can be really, really helpful in terms of improving results and getting that endometrial lining really good. Not to mention, I've also discussed the microbiome and making sure that we have some really good bacteria going on to help improve our chances of implantation. So that'd be some of my top tips. Now I'm just going to move on to a couple of other questions that people ask. So one is around sort of sperm health and what can my partner do? So really, this is kind of going to come back to the basics of sperm and egg 101. Both of them take about 3 months to be made. And in that period of time, so from the immature sperm cell or egg cell to the time where they're either ovulated or ejaculated, everything you eat or drink and everything that's going on in your body is going to impact that little cell. So that's a lot of responsibility. And we know oxidative stress, which is caused by things like, drinking, smoking, unfortunately, aging, all of these things can play a big role in there not being the best cells that there can be. In terms of oxidative stress can really impact like the quality of the cell division and replication, and how well this is happening. So in this period of time, we'd really suggest reducing anything that's going to cause any oxidative stress. And also you can take things to help, improve overall your body's metabolism in terms of being able to kind of clear out any oxidative stress. So things like CoQ10 and also some herbs and supplements can be really fantastic for that. So I'd suggest in terms of sperm, it's absolutely as important in terms of having an ongoing pregnancy and also conceiving. The sperm provider, being your partner or be a donor, is just as important. Doing all this kind of preconception care in that 3 months prior in order to have good quality sperm, good quality DNA that is being passed on. So that means reducing alcohol to the same level. That means reducing cigarettes. It means having a Mediterranean diet, eating lots of fish, all your amino acids, all of those things are going to help. Plus having a prenatal supplement. So that would be the absolute minimum. Acupuncture can really help in terms of improving overall kind of health and well-being and increasing blood circulation to the reproductive organs. There's also been research to suggest it can really help if there's poor morphology, like abnormal forms, or motility in terms of wriggle power. And we've seen this in the clinic also, just when we've been speaking to patients and their partners have come in on the day before they have their eggs collected. And the male partners come in order to get some acupuncture. And I've had patients who had like several cycles because of male factor without us seeing their partner. And so this time, all the partner did was just come in the day before, 24 to 48 hours before they had the egg pickup. The partner had the egg pickup and they did the donation. And it resulted in the embryologist actually saying, like, this sperm looks very different, and we can really see it's like its wriggle power is really improved since the last couple of times we've seen it. And I've had that comment a couple of times in over the years where they've come back down and said, yeah, they really said there was a big difference. But the research also suggests that it does improve motility and morphology. So it's not just a few a few stories like that. So I'd suggest if your partner or sperm donor is considering going through IVF, then you're really looking at doing this together. It's 50-50. It's a team project. And in terms of like the kind of mark you get and the success rate you get is going to be really impacted on both the sperm and the eggs, of course. So, and anything else you can do? Oh, this is such a big question. And I always struggle to kind of answer this because it's, oh, where do you start? So I think the main thing is making sure that you're really confident with the care providers that you have and that all your questions are being answered. And if they're not, there are many fantastic practitioners out there. I refer to wonderful naturopaths, IVF doctors, when I get a patient where I think, wait a minute, I know this is what we can do with Chinese medicine and acupuncture, but I think there's more that can be done with X, Y, and Z. And I'd say, a real kind of team approach can really help people come a really long way and achieve some really fantastic results. So I'd say, make sure you've got a really good team around you, and make sure you're, looking after yourself, making sure you're getting everything you need in terms of support, whether that be professional or personal. Yeah, that would be my top tips. All right, I think we're going to leave it there. If there are any other questions, you can leave them in the comment box below, and I can answer them for you. But it's been such a pleasure spending some time with you tonight. We're making a Monday Q&A. I hope you learned a thing or two, and we look forward to seeing you next week. We love having these Making on Mondays every week, and the whole purpose is for mums and dads to be empowered and to learn a thing or two to help them on their way. So thanks so much, everyone, for joining, and have a great Monday night. See ya.